Hi everyone. Today's lecture will be on basic life support. The purpose of this lecture is to teach you how to assess an emergency situation and describe the priorities in emergency planning, to demonstrate a basic understanding of emergency action principles, and to demonstrate the knowledge and practice of basic life support skills, including CPR and choking. So what is basic life support, or BLS? It is a level of medical care which is used for patients with life-threatening illnesses or injuries until they can be given full medical care by advanced life support providers. BLS support the patient's circulation and respiration through the use of cardiopulmonary resuscitation until advanced life support arrive. It can be provided by trained medical personnel, such as emergency medical technicians, and by qualified bystanders. The knowledge and skills about the basic life support and the advanced life support are the most important determining factors of the cardiopulmonary resuscitation success rate. Now let us look at medical emergency. What is medical emergency? It is an acute injury or illness that poses an immediate risk to a person's life or long-term health. It requires an immediate action. Why do we have medical emergency? Because there is increase in life expectancy, meaning we are getting more and more elderly patients. There is also increase in medically compromised patients. So when there is increase in elderly patient and increase in the number of medically compromised patients, there will be increase in the usage of drugs. So these are the reason why there is an increasing pattern in the occurrence of medical emergency in dental practice. So let's look at the incidence of medical emergencies in dental practice. Studies have shown that vasovagal syncope contributes about 63% of all medical emergencies in dental practice. Angina contributes about 12%, hypoglycemia and epileptic fit contributed about 10%, choking and asthma 5%, and cardiac arrest contributed about 0.3%. So, talking about management of a medical emergency, it is an ethical, moral, legal, and professional obligation owed by oral health care personnel to any patient who enters the dental clinic. So the Malaysian Standard for Dental Professional emphasizes that all dental professionals are responsible for putting patients' interests first and acting to protect them. And they also should ensure that the ability to deal with they also should have the ability to deal with medical emergency that may arise. So the question is, are we prepared for any medical emergencies? Why do we need to prepare ourselves? Why do we need to prepare ourselves? Because we want to prevent the preventables and we want to deal with the unavoidable in the quick, effective, and calm manner. So now let's look at the general principle of the treatment for collapsed patient in dental clinics. It is important to remember that prompt recognition of the early warning signs of an impending collapse is vital. Then we have to act immediately, and we have to always remain with the patient and call for help. In providing the first aid treatment, we should utilize the 3P's principle, that is, preserve life, prevent the situation from becoming worse, and promote recovery. So the general principle of treatment for collapsed patient in dental practice, first is to stay calm, meaning you yourself has to stay calm. Then lay the patient flat, clear and maintain the airway, provide oxygen if available, then check for breathing and feel for pulse. If the breathing and pulse are absent, be prepared to begin CPR or cardiopulmonary resuscitation. So what is cardiopulmonary resuscitation? It is an emergency procedure that combines chest compression with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing. So before we begin CPR or cardiopulmonary resuscitation, it is important to assess the safety of the environment, the safety of the environment for the patient and the rescuer. We also need to assess the patient level of consciousness. We can do this by tapping or shaking the shoulder and ask them loudly, "Are you okay?" Then we need to assess and manage breathing. We need to assess breathing by look, listen, and feel. So look for the chest movement, listen for the breath sound, and feel for the warmth of the breath. The next thing is to assess and manage the circulation. This is where we need to check the carotid pulse. Check the carotid pulse in the anterior groove of the sternocleidomastoid at the level of thyroid cartilage. So try to assess the carotid pulse up to 10 seconds. Right. Cardiopulmonary resuscitation, CPR, is composed of two components, chest compression and rescue breather or artificial ventilation. So when performing the chest compression, we should put the patient on his or her back on a firm surface. Then we should kneel next to the patient, meaning at the chest level. Then we should place the lower palm, the heel of the hand, over the center of the person's chest. If you look at the chest, try to identify the xiphi-sternum junction. Then place your other hand on top of the first with the finger interlocking each other. The next thing to do is you must keep the elbow straight and position the shoulder directly above the hand. Then apply compression on the chest. Compress the chest at least 2 inches or 4 to 6 centimeters. Use your entire body weight, not just the arm, when compressing. So we must push at the rate of 100 to 120 compression per minute. And it is important to allow the chest to spring back after each push. After that, we should give rescue breathing or artificial ventilation. This can be done either mouth to mouth or mouth to nose. To do this, we have to open the airway. And this can be done by head tilt and chin lift maneuver. So when you want to give the rescue breathing, prepare yourself to give 2 rescue breaths. Give the first one first. Watch to see if the chest rise. If the chest rise, give a second breath. If the chest does not rise, meaning there is an airway blockage, so you must repeat the chin lift and the head tilt and give a second breath. Resume chest compression to restore blood flow. So with 30 compression, we should be giving 2 artificial breaths. So 30 to 2 for adult, and for children or for child, we give 15 to 1. The rate of compression of the chest is 100 to 120 per minute. And again, the depth of the compression is about 4 to 6 centimeters. And we need to reassess the patient pulse and rhythm every 2 minutes or after 5 cycles of CPR. Stop the CPR when the patient is revived and start breathing on their own. So this is how you locate the position of the xiphi-sternum, because this is where you're going to place the heel of your palm on top of the xiphi-sternum junction area. Right. When you have located the xiphi-sternum junction area, place the heel of your palm of one hand on top of the xiphi-sternum area. Then place another hand on top of the first and make sure the fingers are interdigitating each other. Then with the shoulder straight, okay. Then make sure the shoulder, the position of the shoulder is above the hand, and when we do the compression of the chest, make sure we use the weight of our body plus the arm and compress the chest about 4 to 6 centimeter, right? And allow after each compression, allow the chest to recoil. Okay, if you are doing the CPR on the dental chair, so you should position yourself and your assistant. So the person at the head area is the one that um, controlling the airway. Eh? That is the person managing the ventilation. And the person that's standing on the side of the chest is the person responsible for the chest compression. Right. This is to show how a collapsed patient will have an airway blockage. And when a person collapses, the tongue will be pushed backward and blocking the upper airway. So to open the airway, we can do a chin lift head tilt maneuver. So by doing that, we can open the airway. If if you suspect there is a cervical injury on the patient, so don't do head tilt chin lift maneuver. We can do a jaw thrush maneuver, yeah, in order to open the airway. So this is the jaw thrush, is the head tilt chin lift maneuver. Okay, when you are giving the rescue breathing or artificial ventilation, make sure with every breath, look at the movement of the chest. Yeah. Movement of the chest indicate there is no blockage of the airway. So these are the common causes of collapse in dental surgery. Fainting, hypoglycemia, fits, cardiac arrest, adrenal crisis, anaphylactic shock, and choking. So now let's look at the general principle of collapse patient on dental chair. As mentioned before, first you yourself has to stay calm. Then lie the patient flat, clear and maintain airway, provide oxygen if available, and check for the breathing and feel for the pulse. If absent, be prepared to begin the CPR. Okay, this is how you position your collapse patient on the dental. So remove any environmental hazard. For example, the dental instrument tray. Lower the chair into a horizontal position. And then the person that sit at the dentist stool at the head end of the chair is the one that managing or monitoring the ventilation. And the person that stand on the side or side of the chest is the one that responsible for the chest compression. So let's talk about cardiopulmonary resuscitation. But before we go further uh, in the discussion of CPR, we should understand the anatomy and physiology of the heart and the lung. Okay? First, let's look at the heart. The main component of the heart are the heart muscles, which contract to pump the blood, the heart chambers, which collect and channel the blood flow, the heart valve, which allows only one-way flow of the blood, and the conduction system, which coordinate the heart muscle contraction, and the coronary blood vessel, which supply blood to the heart. So the cardiovascular system maintains blood flow to deliver oxygen and nutrients to every cell and remove the carbon dioxide and waste product made by those cells. The heart is a muscular organ which pumps a continuous flow of blood through the blood vessels of the circulatory system. So this is a diagram of the heart where we can see blood from the inferior and superior vena cava return to the heart, return to the right atria, that return to the right atrium, and then the blood will be pumped into the right ventricle before the blood being pushed to uh, the lung. The deoxygenated blood will be pumped to the lung, and it will uh, transform into an oxygenated blood and return back to the heart via the left atrium. Then the blood will be pumped into the left ventricle, and will be pumped out from the heart through the aorta to the circulation of the body. So why it is important to have an adequate chest recoil? Due to this simple way of how the blood flow, due to this simple way of how the flow of blood occurs, when the heart stops pumping during cardiac arrest, effective external chest compression push blood out of the heart chambers and thus maintain blood flow and oxygen delivery to the heart, brain, and other vital organs. Eh, The contraction of the heart is coordinated by its conduction system. The heart will fail to maintain a good blood flow if it pumps at a too slow rate, meaning less than 60 per minute, too fast, meaning more than 150 per minute, or in an unorganized rhythm, meaning ventricular fibrillation. Yeah? So in a child, heart rate of less than 60 per minute may require chest compression in order to maintain adequate perfusion. The coronary blood vessel supply oxygen to the heart muscles and conduction system. Most of blood flow, meaning the perfusion, to the heart muscle occur during the diastole or relaxation phase. So this is the reason why the recommended maximum rate of chest compression is 120 per minute and full chest recoil is important to allow for adequate perfusion to the heart muscle and blood filling of the heart chambers during the relaxation phase. Okay, now looks at the lung. Yeah? Human body needs oxygen to sustain life. After about 4 minutes without oxygen, brain cells start dying and can lead to irreversible brain damage and ultimately death. So the main component in respiratory system are the airway, which channel the air to the lung and blood vessel for gas exchanges, and muscle for breathing, to move air in and out of the lung. It is important to remember that room air contains 21% oxygen. And the rescue breathing using exhale air contains about 16% of oxygen. So for most child-related cardiac arrest occur as a result of hypoxic event. Therefore, breathing and oxygenation are important for a successful resuscitation. The tongue may occlude the upper airway in an unconscious patient, thus opening the airway is essential. However, due to anatomical differences between an adult, children, and neonate airway, head, tail, chin leaf maneuver may differ slightly. Overextension of the neck in unconscious infant may occlude the airway. So if you look at this diagram, for adult patient, the head, tail, and chin leaf maneuver will pass the neutral position. Whereas in child, age 1 to puberty, the head, tail, and chin leaf maneuver will only slightly pass the neutral position. And for infant, age 1 year and below, the head, tail, and chin leaf maneuver will be less than the normal neutral position. This is very important in order not to occlude the airway. During the cardiac arrest, the body's metabolic demand for oxygen is decreased, meaning low. Therefore, a smaller amount of air is needed. So when giving ventilation, a visible chest rise indicates adequate volume of air has been given. So overventilation and hyperventilation should be avoided because with each ventilation, intrathoracic pressure will increase. So with increased intrathoracic pressure, there will be decrease in atrial ventricular filling, there will be reduction in coronary perfusion pressure, and there will be distension of the stomach with air, which will reduce diaphragm mobility and increase the risk of regurgitation and aspiration. So this is a chart to show the sequence of steps for the initial assessment and treatment of the unresponsive victim. If the patient is unresponsive with abnormal or absent breathing, it is reasonable for the emergency dispatchers to assume that the patient is in cardiac arrest. So we have to follow this principle. D stands for danger. So make sure that the surrounding environment is safe for the patient and the rescuer. And then checks the patient responsiveness. Eh? This can be done by tapping the shoulder and tapping or shaking the shoulder and say hello or ask the patient, are you okay? And then shout for help. eh? You should ask for help and also ask for a defibrillator. And then check the airway. Perform the head tilt and chin lift procedure in order to open the airway. Assess the breathing. Look for normal breathing in not more than 10 seconds. Start chest compression if patient is not breathing or abnormal breathing is seen. Okay, then check and maybe can start the chest compression. This is we need to try to do a high quality chest compression. This is where, like I mentioned before, we need to compress the chest about 4 to 6 centimeter with the rate of 100 to 120 per minute, and then allow for full recoil after each compression. Okay, and then and the last step is defibrillation. Yeah? So we need to assess the need to shock the patient. Uh, so when there is a need, we can use the AED, automated external defibrillator. So the next few slides is to show the detailed sequence of the step that has been mentioned before. If we follow the sequence, the first thing to assess the danger of the surrounding environment. Second, check the level of responsiveness of the victim. Check the level of response. Uh, so if the patient is responding, you can leave him in the position in which you find him, provided there is no further danger. Then try to find out what is wrong with them, or what is wrong with him. Get help if needed, and we need to reassess the victim regularly. Okay. If the victim is unresponsive, so we should activate the emergency response system or shout for help. Okay. So when you are shouting for emergency response system, you can ask for them to bring the emergency trolley or resuscitation trolley and to get the defibrillator ready. Okay, then we have to assess the airway. This is where we do the head tilt chin lift maneuver. Or for a patient that you suspect there is a cervical injury, uh, you can do a jaw thrust. Okay, you can do a jaw thrust. So to do the head tilt chin lift maneuver, you should place your hand on the forehead, gently tilt the head back, and with your fingertips under the point of the victim's chin, lift the chin to open the airway. In performing jaw thrust, you should use the index and the middle fingers to physically push the posterior aspect of the mandible upwards, while your thumb push down on the chin to open the mouth. So that's the difference between head tilt chin lift maneuver and the jaw thrust. Then assess for breathing. Look for normal breathing in not more than 10 seconds. So we need to determine the absent or abnormal breathing almost simultaneously while opening the airway by looking at the chest, neck, and the face. In the first few minutes after cardiac arrest, a victim may be barely breathing or taking infrequent, slow, and noisy gaps, meaning abnormal breathing. Do not confuse this with normal breathing. Yeah? Treat absence of breath or presence of abnormal breathing as sign of cardiac arrest. Chest compression should be started with the absence of breath or presence of abnormal breathing. If you have any doubt whether or not breathing is normal, act as if they are not breathing normally and prepare to start CPR. And then send someone to get an AED if available. If you are alone, do not leave the patient and start CPR. Okay. Now let's look at the chest compression, the CPR. As mentioned before, you have to locate the xiphi-sternum junction area, kneel by the side of the victim, place the heel of one hand in the center of the victim, center of the chest or xiphi-sternum junction area, and then place the other hand on the first one, and with the finger interlocking each other. Keep your arm straight. Eh, Keep your arms straight. Do not apply any pressure over the upper abdomen or the bottom end of the bony sternum, the breastbone. And then position your shoulder vertically above the victim chest and press down, meaning the shoulder should be positioned above the position of the hand. So we need to get a high quality CPR. We need to do compression at the rate of 100 to 120 per minute. And the depth of compression is about 4 to 6 centimeter. Then allow complete recoil of the chest. After each compression, release all the pressure on the chest. Do not lean on the chest. We must allow for complete recoil of the chest. And the next thing is you should minimize interruption on chest compression. Delivery of rescue breath, shocks, ventilation, and rhythm analysis lead to pause in chest compression. So pre and post shock pauses of less than 10 seconds is allowed. Okay, then the rescue breath. You can use back waft mask ventilation or mouth to mouth or mouth to nose. If you are using back waft mask ventilation or BVM, you should position yourself directly above the victim's head. Place the mask on the victim face using the bridge of the nose as a guide for correct positioning. Use the EC clamp technique to hold the mask in place while you leave the jaw to hold the airway open. So perform the head tilt. Use the thumb and index finger of one hand to make a C on the side of the mask, pressing the edge of the mask to the face. Then use the remaining fingers to tilt angle of the jaw. The three remaining fingers will form an E. Okay. Then squeeze the back to give breath. 1 second each while watching for the chest. Check whether the chest is rising or not. So we're supposed to give for adult 30 to 2. 30 compression to 2 ventilation. If we are if we are doing mouth to mouth rescue breath, pinch the soft part of the nose using the index finger and thumb, and then allow the mouth to open but maintain the chin lift. Take a normal breath and place your lips around the mouth, making sure that you have a good seal. Then blow steadily into the mouth while watching for the chest to rise, taking about 1 second as in normal breathing. This is an effective rescue breath. Maintaining the head tilt and the chin lift, take your mouth away from the victim and watch for the chest to fall as air comes out. Take another normal breath and blow into the victim's mouth once more to achieve a total of 2 effective rescue breaths. Do not interrupt compression by more than 10 seconds. Then return your hand without delay to the correct position on the chest, sternum, and give a further 30 chest compression. Okay. So during delivery of rescue breath, avoid hyperventilation. The ventilation is over 1 second till there is a visible chest rise. This will improve the venous return. Okay. Then the defibrillation. Early defibrillation is an essential step in the chain of survival for victims of cardiac arrest. Defibrillation should be done as soon as it is available in shockable rhythm. Resume chest compression immediately after defibrillation. So when the AED arrive, switch on the AED, attach the electrode pads on the victim's bare chest. If more than one healthcare worker is present, CPR should be continued while electrode pad attached to the chest. Then follow the spoken or the visual. Uh, if a shock is advised, deliver the shock within 5 seconds. Make sure there is nobody touching the patient and tells everyone, I'm going to give the shock. So clear, everyone clear from the victim. Okay, then push the shock button as directed. Immediately restart CPR at the compression ventilation ratio of 30:2. Continue as directed by the voice or visual prompts. Okay, if no shock is advised, continue CPR as directed by the voice or visual prompts. Okay. Then reassessment. After every 5 cycles or 2 minutes of CPR, healthcare practitioners shall check for normal breathing. Do not stop resuscitation until victim recovers with normal breathing. Until the healthcare professional is exhausted or assistant arrive to take over the CPR. To avoid fatigue, the person applying chest compression should be switched every 5 cycles or 2 minutes. Okay, if you are certain the victim is breathing normally but is still unresponsiveness, place the victim in the recovery position. So to do this, you must remove the victim glasses if worn, then kneel beside the victim and make sure that both his legs are straight. Then place the arm nearest to you at right angles to his body. Elbow bend with the hand palm up. Bring the far arm across the chest and hold the back of the hand against the victim cheeks nearest to you. With your other hand, uh, grabs the far leg just above the knee and pull it up, keeping the foot on the ground. Uh, Keeping his hand pressed against his cheek, pull on the far leg to roll the victims towards you onto his side. Then adjust the upper leg so that both the hip and the knees are bent at right angle. Then tilt the head back to make sure that the airway remains open. If necessary, adjust the hand under the cheek to keep the head tilt and facing downwards to allow liquid material to drain from the mouth. And then check breathing regularly. This is how we position patient in a recovery position. So, what are the signs that the victim has recovered? One, patient has started to wake up, moving around, open the eye, and patient is performing normal breathing. So, in performing CPR, if two persons are performing the procedures, one, as mentioned, will be at the victim's side and the other at the victim's head. Uh, the person that positioned at the victim's side, this is the one that performing the high quality chest compression. The duty is to perform chest compression. So should be performing high quality CPR, compressing at the rate of 100 to 120 compression per minute, with the depth of compression about 4 to 6 centimeter. Remember that injuries are more common when compression depth is greater than 6 centimeter. Also, you must allow for complete recall of the chest and make sure you do not lean on the chest. Minimize interruption on the chest compression. Delivery of rescue breath, shock and ventilation, and rhythm analysis can lead to pause in chest compression. So the pre and post shock pauses should be less than 10 seconds. Avoid hyperventilation. Okay, so you can switch duty with the other person every 5 cycles or about every 2 minutes. Yeah? Okay, and the person that positioned at the victim head, this is the one that maintaining an open airway using head tilt chin lift maneuver or jaw thrust. This is the person also to give breath watching for the chest rise and avoid hyperventilation. Right. Now let's look at automated external defibrillator, or AED. Early defibrillation is one of the key link in the chain of survival. 80 to 90% of sudden cardiac death is due to ventricular fibrillation. The survival rate reduces by 7 to 10% each minute if without early CPR and early defibrillation. The survival rate is about 3 to 5% only if CPR is provided. However, the survival rate will increase drastically to 30 to 70% by giving early CPR and early defibrillation. AED is a portable, battery-operated device that can automatically analyze the cardiac rhythm. It required electrical shock if it is a shockable rhythm. It is very simple to operate, allowing laypersons and healthcare providers to attempt defibrillation safely. During the ventricular fibrillation, the heart muscle fibers queer and do not contract to pump the blood. Defibrillation delivers a preset electric current across the heart muscle fibers to stop the queering and restore the normal cardiac rhythm of the heart. So this is the chain of survival. Very important to early recognize the situation. So early recognition is very important to prevent cardiac arrest. So if you recognize there is a problem, should start with the early CPR. Then we can give an early defibrillation, yeah, in order to restart the heart. And the last in the chain is post resuscitation care. eh. This is in order to restore the quality of life. So that is the chain of survival in basic life support. So these are the automated external defibrillator. There are many types of it. So how to use AED? So we should start the power on. Place the AED next to the patient and open the carrying case or the top of the AED. Turn the power on. Okay. Choose adult pad for victim 8 years of age or older. Peel open the AED pads. Then attach the adhesive pad to the victim's bare chest. Then place one AED pad on the victim's right upper chest, meaning directly below the clavicle, and place another AED pad to the side of the apex of the heart. The placement of the AED should not interrupt the chest compression. Any open flow of oxygen should be diverted away from the chest to avoid fire hazard. So this is how you place the pad on the chest. Okay. Then AED will prompt you to clear the victims during rhythm analyzing. Be sure no one touches the victim, including the healthcare worker in charge of giving the breath. Okay. Some defibrillator with AED function will prompt the operator to push a button for analyzing the heart rhythms. Others will do that automatically. The AED then tells you if a shock is needed. So if a shock is needed, clear the victim from contact with people before delivering the shock. Make sure no one is touching the patient. Loudly shout out clear and perform a rapid visual scan to ensure everyone is cleared from touching the patient. The rescuer should then press the shock button. The shock will be delivered by producing a sudden contraction of the victim's muscle. Immediately resume the CPR after delivering of the shock. However, if the shock is not indicated, there will be no shock advice from the AED, and the healthcare worker has to continue with the chest compression immediately. After 5 cycles or 2 minutes of CPR, the device will prompt you to repeat step 3 and step 4. If no shock advice, the healthcare worker should immediately restart the CPR, beginning with chest compression. So there are some consideration in special situation. In the case of hairy chest. A hairy chest will impede the flow of the electricity from the pads through the chest, so hinder the adherence of the pads and possibly be a fire hazard. Thus, it is advisable to shave the area in which the pads are to be placed. Second, when the victim immersed in the water or water is covering the victim's chest. Water is a good conductor of the electricity, and this will prevent the delivery of the adequate dose of shock to the heart. The victim should be removed from the water prior to attaching the pads. If the chest is covered with water, use a towel to wipe the area before attaching the pads. Uh, Third special situation is implantable defibrillator and pacemaker. The victim may have an ICD, implantable cardiac defibrillator, or pacemaker placed beneath the skin at the upper chest or abdomen. In this case, the healthcare professional should avoid placing the AED pad over the ICD or pacemaker, as it may block the delivery of the shock to the heart. If the ICD is delivering a shock, allow 30 to 60 seconds for the implantable defibrillator to complete the treatment cycle before delivering a shock from the AED. Okay, the last situation is where there is a transdermal medication patches. Do not place AED pads directly on the top of medication pad. Nitroglycerin, for example, nitroglycerin pad or nicotine pad, as they may block the transfer of energy to the heart and may cause small burn to the skin. We may remove the patch and wipe the area clean before attaching the AED. Okay, the next and the last thing to discuss is choking. Uh, Choking occurs when a foreign body obstructs the trachea. Rescuer should only intervene in patients who show signs of severe airway obstruction, such as a silent cough, cyanosis, or inability to speak or breathe. If a patient is coughing forcefully, rescuer should not interfere with this process and encourage the patient to keep coughing. If a patient shows signs of severe airway obstruction, anti-choking maneuver such as a back slaps or in the most severe cases abdominal thrust should be applied until the obstruction is removed. If a patient becomes unresponsive, he should be lowered to the ground and the rescuer should call emergency medical services and initiate CPR. When the airway is open during CPR, the rescuer should look into the mouth for an object causing obstruction and remove with a finger sweep it. So this is a diagram to show how to assess severity of choking. In a severe airway obstruction, where there is ineffective coughing, patient may be unconscious or conscious. If patient is unconscious, should start CPR. For conscious patient, we can give 5 back blows or 5 abdominal thrusts. In a mild airway obstruction where patient has effective coughing, we can encourage cough and continue to check for deterioration to ineffective cough or until obstruction is relieved. So this is the sequence of steps for managing the adult victim who is choking. If you suspect the victim is choking, you should encourage the patient to cough. Encourage the patient to cough. If coughing becomes ineffective, give up to 5 back blows. Give 5 sharp blows between the shoulder blades with the heel of your hand. If back blows are ineffective, give up to 5 abdominal thrusts. Clench your fist and place it between the umbilical and the rib cage. Place it in between the umbilicus and the rib cage. Grasp this hand with your other hand and pull sharply inward and upward. Repeat up to 5 times. If the obstruction is still not relieved, continue alternating 5 back blows with 5 abdominal thrusts. Okay, start CPR if victim become unresponsiveness. Okay, uh, so begin CPR with chest compression, and then continue cycle of 30 compression and 2 ventilation is the most effective way to provide care. Even if ventilation fail to make the chest rise, compression may help clear the airway by moving the blockage into the upper airway, where it can be seen and removed. So treatment for mild airway obstruction: encourage patient to cough in order to generate high and sustained airway pressure, which may expel the foreign bodies. Put victims under continuous observation until they improve, as severe airway obstruction may develop subsequently. And treatment for severe airway obstruction: approximately 50% of airway obstruction following choking are not relieved by a single technique. So success rate is increased when combination of back blow or slap and abdominal and chest thrust are used. So for treatment of choking in an unresponsive victim, higher airway pressure can be generated using chest thrust compared with abdominal thrust. So the bystander initiation of chest compression for unresponsive or unconscious victim of choking is associated with improved outcome. Therefore, start chest compression promptly if the victim becomes unresponsive or unconscious. After 30 compression, attempt to rescue breath and continue CPR until the victim recovers and start to breathe normally. So aftercare and referral for medical review. Following successful treatment of choking, foreign material may remain in the upper or lower airway and cause complication later. And a patient will present with sign and symptom. Patient may present to you with certain sign and symptom, which should seek for medical advice. Example of sign and symptom are persistent coughing, difficulty in swallowing, and sensation of an object still being stuck in the throat. Okay? It is also important to remember that abdominal thrust and chest compression can potentially cause serious internal injuries, and all victims successfully treated with these measures should be examined afterwards for any. Right. So the conclusion from this lecture is that the knowledge and skill about the basic life support and the advanced life support are the most important determining factors of cardiopulmonary resuscitation success rate. BLS and other resuscitation skill should be part of the undergraduate curriculum, and students should master the skills during their study. Healthcare provider should have the ability to deal with medical emergency that may arise. And it is important to realize the difference between doing something and doing nothing could mean someone's life or death. Okay, this is my reference, Basic Life Support Training Manual under the Ministry of Health of Malaysia, year 2017. So with that, I end my lecture. Thank you.